I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Welcome to Medoscopy. If you've been watching the show for a while, you may say, hey, things look a little different. That's because we are filming from our studio here at Mercy Medical Center, high atop the tower building on the 14th floor. But thank you for joining us for today's procedure. Our guests are Mercy nurses, Evasue Afton Brown and Andrea Staiti. Little background, where are you from both originally?
I'm from Baltimore. Grew up here, raised here.
Mm-hmm. Born and raised in Maryland. Spent my first 12 years in PG County, and then I've been in Anne Arundel County ever since.
So you're native Marylanders?
Yes.
Mm-hmm. Never moved anyplace else or lived anyplace else?
No.
No, that's pretty typical, from what I understand. How did you each wind up here at Mercy?
Do you want to go first?
Sure. I have worked in orthopedics for over 20 years. I used to work at a couple of the offices that fed Anne Arundel Medical Center, and a friend left, and at that point in my life, I was ready to grow and move on, and I was actually looking for a hospital that offered tuition reimbursement. My friend had left the office that we worked at together and came here, and she said, hey, we're looking for a medical assistant, and they offered tuition reimbursement. I know that's something you're interested in. Send me your resume. So she did, and I interviewed, and 13 years later, here we are.
How about you?
So I worked in my same type of department, interventional radiology, cardiac cath lab at Maryland General Hospital, now Midtown. And I worked there up until I had my boys, my twin boys. It was a difficult pregnancy, so I wasn't able to continue working. So when they were about 10 months old, a guy that I worked with at Maryland General had a very close friend that was the manager of the department here at Mercy, and they were hiring, and he thought that I would be a good fit. And 19 years later, I'm still here.
You're still here.
Yeah.
Oh, there you go. I noticed there's, in terms of your titles and so forth, there's a lot of, I call it the alphabet soup. I think most people probably know RN means registered nurse. Mm-hmm. But then there's BSN, CV-BC. There's other terms that most people may not know about, that you work in the PACU, so it's like, can you explain some of these terms for our viewers?
So the CV is a cardiovascular certification. So CVRN is that is my certification that I did through the ANCC. And it was something that Mercy encourages and lays the groundwork, gives you opportunities for pursuing, growing your education. And so I decided I wanted to become certified, and I did that with the help of Mercy.
I was going to say same for me. I actually just attained my certification. I am CPAN, which is Certified Peri-Anesthesia Nurse. I've worked in the PACU, which is the Post-Anesthesia Care Unit, for about 5 years now. And the PACU that I work in does primarily orthopedics and neuro. So a lot of joints, spine, even so much as craniotomies, all that type of stuff. So I've been there long enough, and it was about time, and I agree with Andrea. Mercy does a great job of encouraging our professional development, and made that goal to achieve that certification very attainable.
So let's take a step back even further. Why nursing? Is this something that you both had an interest in at some point, or it's like, oh no, I was, going to be an opera singer or something, who knows what. So, but why'd you wind up in this particular field?
For me, I really can't see myself doing anything else. I can remember as a little girl having a sick uncle, and I used to, just what can I get you to drink? Can I get you a blanket? Like, I just wanted to dote on him and cater to him a little bit. So I kind of knew that that was for me. I liked being able to take care of people, and not just the patient, but also the family that comes with them for their procedures. It's a very scary time for the whole entire family. So it just seems like the perfect fit for me.
Yeah, I would agree with Andrea. Although initially, I wanted to be a businesswoman and I wanted to do marketing, and I was kind of making my way towards that until my grandmother fell ill. She had a stroke, and then shortly thereafter was diagnosed with non-Hodgkin's lymphoma, and then had brain metastases. So she was sick for a really long time, and you know, like a lot of families here in the Baltimore area, you want to bring your family home and you want to take care of them. And but while she was in the hospital, I just grew such a deep respect and admiration for the nurses that cared for her. And then even when she came home on hospice, I was just enamored with the care that they gave, not only to my grandmother, but to my family. And I was like, wow, I want to do that. And then kind of going through hospice with other friends and family members, it just kind of really struck a chord with me, and I completely deviated directions and went into nursing. That was what I wanted to do, and I agree with Andrea. I can't imagine myself doing anything else.
Well, what you're telling me isn't anything different really than I've heard from just about every doctor, dietitian, now nurses who have told me that it's oftentimes it was a family member who had become ill, whether it was a sibling or a parent, or if that wasn't the case, someone in their family was in the medical profession. So there was always this connection to family that seemed to make the difference about where to go into nursing. So how's it been? You became a nurse, you got your certification. Is it everything you thought it would be? Or what surprised you, for example?
I think for me was, and Andrea can probably agree to this, and it's one of the things I do a lot of precepting to new nurses, and I tell them, your first year is the toughest. You're going to question whether you made the right decision. It is really tough, but if you stick with it and you have faith in yourself, faith in your practice, it really just kind of grows and develops and just becomes something that you actually love and are passionate about.
I would say when I graduated nursing school in 1996, I remember them always saying, you're advocating for your patient, you're advocating for your patient. And nurses very much advocate for our patients every day. One thing I wish that they would have done a better job explaining, and maybe they do now since I've been in the field for a while, it's also a business. And in order to sustain and stay a good hospital, they have to look at the financial aspects of it. And so they didn't really do a good job in nursing school at explaining how to advocate for your patient, but also be mindful of the cost restraints or some of the limitations that you might have. So I found that to be really discouraging my first few years. Obviously, I stuck with it, and it's interesting you were talking about family. One of the reasons I think that I've remained here at Mercy is because it is very much a family feel. You walk through the halls and you know people by name. They say hello. My unit in particular, I feel like we've all watched each other's children grow up. Some get married, have children of their own. So it really helps balance some of the not so good days. If you have a patient that doesn't have a good outcome, you know that you can lean on your coworkers, and they truly are like family.
So you actually lived the reality of it. I mean, you know what nursing is like. You've been doing it for many years. Most people who aren't in the medical field they get their ideas from what they see on TV. So, whether it's Grey's Anatomy or Scrubs or something like that. So I'm kind of curious, who gets it right and who gets it wrong? And I imagine there's a lot of wrong. So
A lot of wrong. They make it look very glamorous.
Yeah, they do.
And it's not. It's funny. I'm not sure that there's a show that comes to mind that gets it 100% right. And I don't want to say the wrong show, but I feel like I watched an episode of Chicago
Chicago Hope?
MD.
Oh, Chicago Hope, I think is what it was called.
I think it's Chicago MD. It's on now.
Oh, it's on now.
Yes.
Oh, okay. This is an older program.
Yep. And there was a patient that came in, and here's the ED doctor, and he's doing all of his care and assessments, and then he whisks the patient away to like an angiography or cardiac cath lab suite, and then next thing you know, he's doing the procedure. And I'm thinking, that would never happen. I feel like in the shows, you have like a core group and they do everything. And it's very much a team and lots of people involved.
Very multidisciplinary,
Yeah.
for sure. I mean, I'm not huge on medical shows. I do it at work, so I like to escape from it sometimes. But one of the things I feel like I almost always see are like oxygen tubing as an IV, like just kind of taped to the skin. So that's quite funny. But I don't know that, I'm with Andrea, I don't know that I've ever really seen anyone get it right.
No.
Well, doctors, of course, end up choosing specialties, whether it's orthopedics or brain surgery or primary care. Now, how does that process work for nurses?
That's kind of one of the beauties about nursing is that, kind of when we graduate, we're nurse generalists. And, I think some people kind of really have an idea of what they want to go into. For me, I've worked in orthopedics for over 20 years before I was even a nurse. So it was just a no-brainer for me. That was where I was going to go. But I did leave orthopedics for a little while, and I went to post-transplant care. Found out it wasn't for me, and I came back. But that is the beauty of nursing, is that, you can kind of try different areas and move around in it if you so choose.
So you maybe have more flexibility than, say, for example, someone who's an orthopedic surgeon just decides, I'm not sure about this orthopedic surgery. I'm going to try heart surgery for a few months or whatever, and then they can't do that, obviously.
Right.
So nurses have a little more flexibility, would you say?
Yes,
Absolutely.
there's a lot of different opportunities, especially, as you start off as a younger nurse, you have a lot more energy, less maybe ties at home, family. It's easier to do the overnight shifts, the weekend shifts. But then we're both in roles now that we don't have to work weekends. We do call for weekends for emergent cases, but you get a little bit more work-life balance that way. There's lots of people that choose they don't want to do bedside nursing anymore, so they go into informatics or case management or something like that. It does give you a lot of different opportunities. I started in the emergency department. That's where I got a job. It was hard to get a job when I first graduated. And now I feel like we don't have enough nurses, so you pretty much can choose where you want to work. So it's, there's a lot that you have in front of you when you choose nursing.
So we've talked a little bit about what it's like in terms of your work as a nurse. When you're not working as a nurse, what do you like to do? Afton, I know you like to travel, enjoy the great outdoors. Tell us a little bit about that.
My family loves travel. I guess two of our favorite places that we've been were Southern Utah and, of course, Hawaii. Hawaii is one of our favorites. Kauai, to be specific. Yeah.
I've been there myself. It's beautiful. I have a friend who owns a home there.
So. Yeah. We enjoy a lot of hiking and camping, and we're a little more outdoorsy. So, we joke, we have some friends who vacation with us, and before they started vacationing with us, they, were always at resorts and when we told them, no, we're going to stay in an Airbnb in a little town that you've never heard of, and they're like, what? But it's kind of cool because I think we've influenced them in the way that they travel a little bit. So.
Now, you also have a son who plays baseball. Have you had to
Yes.
deal with any of your son's injuries in sports?
Yeah, nothing major, thank goodness. Some little aches and pains. But I feel like more frequently they don't happen on the ball field. It's, kind of with play or in between games. Probably the worst one was he was trying to jump a fence. His toe caught the fence and he face planted into the concrete.
Oof.
I know. So he was banged up a little bit, had a little concussion, but he came away unscathed. So it was good.
Now, Andrea, you're a mom of 3. We have twin boys who are nearly 19 and a daughter soon to be 21. Is that correct?
Yes.
Okay. And they play sports. What sort of
Yes.
sports do they do?
Yep. So my boys played soccer. They actually just had a tournament this past weekend, and they were undefeated, so they won their little division. They played ice hockey in high school, which was really fun. They loved playing ice hockey. My daughter also played soccer, and she was a dancer. So lots of soccer. 2 out of 3 children have broken bones, all playing soccer. But we still love soccer, so makes them tougher, I guess. Yeah.
Now, I understand that you're celebrating your 25th wedding anniversary with your husband, whom you met at Maryland General in
That's right.
'97. But now he works here at Mercy as
He
well?
does.
Okay, now, what's that like to have deal with your spouse both at home and at work?
It's interesting. He actually came to Mercy before I did, so he was here a year before me. And he, like Afton, worked at one of the hubs. He did most of his time at Mercy at Overlay Personal Physicians as a CAT scan tech. When I met him, he was doing MRIs at Maryland General, but also did CAT scans. Now he has made the decision to change fields a little, and he's working in interventional pain here at the hospital. So we're actually on the same floor, different departments though, and we joke that there's like a shield that he can't pass. Every once in a while we carpool, but I kind of like my routine. So we try to keep it separate still.
Well, we'll take a break and we'll return after this message.
We as the people make Mercy different.
I can honestly say it's the people here.
Mercy employees are just warm, welcoming, kind. They're so passionate about what they do. Everyone that I've met here has an immense depth of knowledge, and people are so emotionally intelligent.
It seems that everyone is working on the same wavelength to make sure that every patient has a great experience. I think that's the secret sauce.
The atmosphere is different. Mercy's like a family.
I love the family I work with. They are all valuable and important to me inside and outside of work, and I think that we all develop a different relationship than anywhere else I've ever worked before.
Mercy does things, I would say, all of the time, whether it's Orioles opening day or the Ravens or Catherine's Day. Mercy always engages the employees.
Celebrating through little things like food and through activities.
Those little things resonate with the staff. They, unexpected things that they feel appreciated. And I think that that's special. And I can tell you for a fact that almost no other hospital in Baltimore is doing that.
There's something special about the people that work here. And there's people that have been here for so long. And those people are always very kind and generous with their time to help somebody that's new.
I was kind of nervous coming in. This was like my first, real job, and so I'm nervous. New environment, new people, and everyone made me feel really welcomed and helped me out along the way, and it's been a really great experience.
They give you a chance to figure out what you want to do, where you want to go, to allow you to spread your wings. I just thank Mercy for giving me a chance to work here.